You cannot heal your kidney if you do these 10 things daily. You must watch this entire video because I know for sure that the 10 seemingly harmless habits in this video are silently destroying and causing serious damage to your kidneys. Shocking, right? But this is reality. The kidneys are important organs that help filter blood, remove waste and toxins through urine, maintain water balance, electrolytes, and blood pressure. In addition, the kidneys also participate in the production of hormones that regulate red blood cell production and play an essential role in maintaining the overall health of the body. However, some daily habits have been discovered, and this is one of the few videos that publishes this analysis data. If you seriously watch this video and make timely adjustments, I'm sure your health will improve significantly. In today's video, we've uncovered the top 10 daily habits that can be silently sabotaging your kidney health. If not caught and changed in time, the cause of chronic kidney disease is very high. So follow along in this video as we go from 10 to 1 with the most damaging habit revealed at the end. Let's find out. 10. Smoking. Cigarettes are probably too familiar to us every time we step out on the street. We always see the image of other people smoking. Because cigarettes have been considered a habit of people, whenever they have free time they smoke. Some people are even addicted to cigarettes. They can't stand it for a day without smoking, and that is the reason why their health is getting worse. Studies have shown that smoking increases the risk of developing kidney cancer by 20% to 50%. Not only that, smoking also increases blood pressure and heart rate, leading to reduced blood flow to the kidneys, a factor that directly damages the kidneys over time. In addition, smoking also increases the risk of diabetes and high blood pressure, the two most common causes of kidney failure, and speeds up the progression of these diseases. Another dangerous effect of smoking is the increased production of the hormone angiotensin II, a hormone that helps regulate blood pressure. When this hormone level increases, blood pressure also increases, and the amount of blood supplied to the kidneys is significantly reduced. As a result, the blood vessels in the kidneys narrow, causing the organ to not receive enough blood and oxygen to maintain normal function. Smoking also damages the arterioles, which are small branches of the arteries responsible for supplying blood directly to the kidneys. This damage not only reduces kidney function, but also increases the risk of chronic kidney failure and other serious diseases. To protect the health of the kidneys and the body in general, quitting smoking is an effective and necessary solution. 9th, hold your urine. Holding urine comes from many unexpected situations in life, maybe because of being too absorbed or busy with work and trying to hold urine to work, or maybe having to pee but not being able to find a toilet. For the above reasons, we have unintentionally negatively affected our kidneys, especially kidney function. The adult bladder can hold about 420 milliliters of urine, but when holding urine, the bladder must expand too much, causing tension in the external sphincter muscles. This, if it happens regularly, can lead to loss of sphincter control, causing urine leakage and creating conditions for bacteria to invade, leading to urinary tract infections. In addition, holding urine for a long time can also cause serious problems, such as kidney stones. When urine is retained in the bladder for too long, the waste products can crystallize and form stones. Kidney stones are not only painful, but can also lead to kidney damage if not treated promptly. Moreover, prolonged urine retention can cause kidney failure. Urine stagnant in the bladder can flow back up to the kidneys, causing damage and reducing the kidney's filtering function. Symptoms of kidney failure include fatigue, edema, and reduced ability to filter toxins from the blood. To protect kidney health, it is necessary to minimize urine retention and respond to the need to urinate as soon as possible. If there are abnormal signs related to the urinary tract, you should see a doctor early for timely diagnosis and treatment. 8. Alcohol abuse. It is difficult to say that we will not drink alcohol even though it has a negative impact on health, although we all understand the harmful effects of alcohol on our health. But for a long time, alcohol and beer have been a way of social communication that helps us get closer to each other. Even in some countries, alcohol has become a cultural feature when mentioned, such as French and Italian wine, famous beer festivals in Germany. And the truth is that alcohol, when consumed in excess, directly and indirectly affects kidney health, seriously impairing the function of filtering blood and balancing water in the body. The kidneys, which have an important role in removing waste, regulating minerals, and producing hormones, will have to work hard to handle the large amount of toxins from alcohol. Drinking a lot of alcohol, especially 5 or more drinks at a time, can cause acute kidney injury, a condition in which the kidneys lose their ability to maintain fluid balance and toxins accumulate rapidly in the blood. Although it can be reversed if treated promptly, this damage increases the risk of developing chronic kidney disease in the future. According to the National Kidney Foundation of the United States, regularly drinking a lot of alcohol can double the risk of chronic kidney disease, and the risk is even higher when combined with smoking. Not only that, drinking alcohol also indirectly damages the kidneys by increasing the risk of high blood pressure and type 2 diabetes, the 2 most common causes of kidney failure in the U.S. In addition, alcohol abuse leads to liver disease, which reduces blood flow to the kidneys, seriously affecting kidney function. Many patients with both liver failure and kidney failure have a history of long-term alcohol abuse. To protect kidney health, limiting alcohol consumption and maintaining a healthy lifestyle is extremely necessary. 7. Not enough sleep. Sometimes being engrossed in watching a movie or going out late with friends and coming home late the next morning and having to go to work or simply staying up late to text or chat, sometimes it doesn't affect your sleep too much. But if that situation lasts from day to day, month to month, continuously for many years, then surely you are also feeling that your kidneys have a problem, right? Due to work, habits, or some other reason, you are often in a state of lack of sleep. You need to know that. Not getting enough sleep not only causes fatigue, decreased concentration, but also has a serious impact on kidney health. The kidneys play an important role in filtering blood, removing waste, and maintaining water and mineral balance in the body. A quality sleep is essential for the body, including the kidneys, to recover and maintain stable function. Research shows that lack of sleep or poor quality sleep can disrupt the body's natural cycles, including the circadian rhythm that controls kidney function. At night, the kidneys typically slow down to allow the body to rest, but when sleep is lacking, this rhythm is disrupted, causing the kidneys to work continuously. This condition, if prolonged, can put stress on the kidneys and impair function. In particular, insufficient sleep can increase the production of the stress hormone cortisol, which affects blood pressure and the kidney's ability to filter blood. Experts recommend that everyone should sleep 7 to 9 hours per night to maintain optimal health, including protecting kidney function. A good night's sleep not only helps the body recover, but also prevents risks related to kidney and overall health. Get enough sleep so your body can recover and continue to accompany you. 6. Sugar abuse in the diet. Sugar appears in all foods, from healthy to vegetarian and fast food, from fruits to foods containing high sugar content. We often eat unconsciously to satisfy our taste buds without paying attention to the serious consequences of sugar abuse in the diet, or in other words, sweet addiction. Sugar not only affects weight but can also seriously harm kidney health. When consuming too much sugar, the kidneys have to work harder to filter out harmful substances, causing stress on the small blood vessels in the glomerulus, which plays a major role in filtering and excreting urine. In people with diabetes, prolonged high blood sugar levels damage the capillaries in the glomerulus, causing these filters to work excessively. Over time, the filtering holes in the glomerulus widen, leading to protein leaking out through the urine, causing proteinuria and severely affecting kidney function. If left unchecked, this damage will cause the kidneys to gradually become fibrotic and lose their function completely, leading to kidney failure. In the final stages, patients are forced to undergo dialysis or kidney transplantation to sustain life. In the United States, diabetes is the leading cause of kidney disease and kidney failure, said Dr. Anjay Rastogi from the University of California, Los Angeles. According to the World Health Organization, WHO, diabetes is the leading cause of chronic kidney disease and kidney failure globally, with millions of people facing the risk of death from related complications. In addition, too much sugar intake also increases the concentration of urine in the blood, directly damaging the kidneys. Consistently high blood sugar levels damage fragile blood vessels, increasing the risk of kidney disease and other dangerous complications. To protect your kidneys, controlling your sugar intake is essential, especially for those at high risk such as diabetics. Cutting down on sweets and maintaining a healthy diet is an effective way to prevent serious kidney problems. 5. Not drink enough water. According to statistics from the world's leading health organizations, more than 50% of adults do not drink enough 2 liters of water per day, simply because they are not conscious about drinking water. And I know you can be in that 50%, right? Because we are only taught to drink water when thirsty, not enough to drink 2 liters of water per day. Water plays an extremely important role in filtering blood and removing waste from the body. When you do not drink enough water, the amount of blood flowing through the kidneys is significantly reduced, forcing the kidneys to work harder to filter and maintain function. Prolonged dehydration leads to more concentrated urine, increasing the risk of kidney stones due to crystallization of substances such as calcium, oxalate, and uric acid. Research from Johns Hopkins University shows that people who drink little water are 1.5 times more likely to form kidney stones than people who drink enough water. In addition, lack of water also reduces urine output, creating conditions for bacteria to grow in the bladder, leading to urinary tract infections. The kidneys also regulate the concentration of electrolytes such as sodium and potassium in the body. When there is a lack of water, this balance is disrupted, causing the kidneys to work too hard, leading to long-term damage. According to the American Journal of Nephrology, not drinking enough water for a long time reduces the filtering function of the kidneys, which can lead to chronic kidney failure. A study from the National Kidney Foundation shows that people who do not drink enough water every day have a 30% higher risk of developing chronic kidney disease. Maintaining the habit of drinking at least 2 to 3 liters of water per day not only protects the kidneys but also helps the entire body function at an optimal state, preventing serious health complications. 4. Consuming too much salt. Surely many of us have heard about the harmful effects of eating salty foods on the kidneys, but few people pay attention and adjust the amount of salt to suit their body and diet, simply because it is a habit that we often ignore. Eating too much salt not only has a negative impact on cardiovascular health, but also causes many serious problems for kidney function. Sodium, the main ingredient in salt, plays an important role in balancing water and electrolytes in the body. However, when consuming too much salt, the kidneys lose their ability to control the balance of sodium and water, leading to consequences such as dehydration, high blood pressure, and impaired kidney function. According to research from Tulane University, high sodium intake in the diet is associated with faster progression of chronic kidney disease, CKD. Researchers tested urine samples of nearly 4,000 CKD patients and found that those who consumed more sodium than recommended, an average of 3,700 milligrams per day compared to the recommended 2,400 milligrams per day, were at higher risk of kidney complications. Chronic kidney disease not only leads to kidney failure, but also increases the risk of heart disease and premature death. The World Health Organization, WHO, recommends that adults should consume no more than 5 grams of salt per day. Each year, about 4.1 million people worldwide die from diseases related to excess salt consumption, including kidney failure, glomerulonephritis, and kidney stones. Reducing salt intake is a simple but effective way to protect kidney health and prevent dangerous related diseases. 3. Overuse of painkillers. In many unavoidable cases, we have to use pain relievers to relieve immediate pain. Pain relievers are easily purchased and widely used for many diseases that require pain relievers, such as stomach aches, headaches, etc. However, accidentally using an overdose has caused serious harm to the kidneys. Abusing pain relievers, especially non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, aspirin, or naproxen, can have serious consequences for kidney health. Although these drugs are very effective in relieving pain and inflammation, using them regularly or for a long time can damage kidney function. NSAIDs work by reducing inflammation, but at the same time, they also reduce blood flow to the kidneys, causing this organ to work too hard and become vulnerable. Over time, overuse of NSAIDs can lead to a condition called analgesic nephropathy, a serious type of chronic kidney damage. Analgesic-induced kidney damage is often irreversible and can lead to chronic kidney disease, CKD, which causes a gradual loss of kidney function. In severe cases, the patient may face the risk of end-stage kidney failure, requiring dialysis or a kidney transplant. Worryingly, many people do not realize this harm when using NSAIDs arbitrarily to relieve pain every day without consulting a doctor. To protect kidney health, it is necessary to limit the use of painkillers and only use them when really necessary. If you need regular pain relief, you should consult your doctor to find safer alternatives or identify the root cause of the pain. Using drugs consciously is an effective way to avoid unnecessary kidney damage. 2. Eating too much protein. Consuming too much protein-rich foods is becoming a popular trend in the US, especially in diets like Atkins or keto. Protein is an essential nutrient that helps build and repair tissues in the body. However, consuming too much can have negative effects on kidney health. According to the Institute of Medicine, there is currently not enough evidence to determine the maximum safe level of protein consumption for the body. A study published in the American Journal of Clinical Nutrition shows that a high-protein diet can increase the risk of kidney stones and kidney damage, raising many questions about the effects of this eating habit. When the body consumes a large amount of protein, the kidneys have to work harder to process nitrogen waste from the breakdown process. This overload puts a strain on the kidneys, causing long-term damage, especially in high-risk individuals, such as those with chronic kidney disease. Excess protein consumption not only reduces kidney function, but can also lead to end-stage renal failure, requiring dialysis or a kidney transplant. In addition, animal protein also increases calcium and uric acid levels in the urine, two major factors that cause kidney stones. To protect kidney health, adults should limit protein intake to about 0.8 to 1 gram per kilogram of body weight per day, or as recommended by experts. At the same time, combining a balanced diet and drinking enough water is an effective way to reduce pressure on the kidneys and maintain long-term health. 1. Not controlling chronic diseases. Why is this the most serious cause listed at the top of the top 10 daily lifestyle habits that negatively affect the kidneys? Because the truth is that we ourselves do not know that in the worst case, we are suffering from chronic diseases that directly negatively affect the kidneys, such as diabetes, blood pressure, cardiovascular disease, because we do not know that we may have been sick from deep inside for a long time, so we still maintain such daily living habits. And it is this normal living habit that is unintentionally making the underlying diseases in the body worse and causing serious damage to the kidneys. Until the disease is severe enough, the body will develop the disease, and at that time, will it still be too late for us to treat the disease? The kidney is an important organ responsible for filtering blood and removing waste from the body. When chronic diseases are not controlled, the kidneys are overworked, leading to damage and impaired function. In diabetic patients, prolonged high blood sugar levels damage the small blood vessels in the glomeruli, reducing the kidney's filtering ability. This condition can lead to diabetic nephropathy, a major cause of chronic kidney failure. Similarly, uncontrolled high blood pressure also damages the blood vessels in the kidneys, making it difficult to filter blood and maintain fluid balance in the body. In addition, chronic diseases also increase the risk of inflammation and scarring in the kidneys, causing kidney fibrosis. Over time, this damage can progress to chronic kidney disease, CKD, leading to end-stage kidney failure. At this stage, patients need dialysis or a kidney transplant to stay alive. To protect the kidneys, good control of chronic diseases is essential. Maintaining a healthy diet, drinking enough water, exercising regularly, and taking medication as directed by your doctor will help reduce the risk of kidney complications and maintain overall health. Prevention is better than cure, so let's have a general health checkup every 6 months to check if our diet and living habits are good for our body, and also check for underlying diseases so that we can promptly adjust our living habits to better protect our health. Before leaving, let's take a look back. Every day we unconsciously perform seemingly harmless habits, but in fact, they silently destroy the health of our kidneys, an important organ that helps the body purify and maintain life. From abusing painkillers, eating too much salt and protein, to not drinking enough water or ignoring control of chronic diseases, all are creating a persistent attack on our kidneys. In the United States, where fast food, busy lifestyles, and drug dependence are common, chronic kidney disease rates are on the rise. putting millions of people at risk of needing dialysis or a kidney transplant to survive. Have you ever thought that by adjusting a few small habits, you could save your kidneys from irreversible damage? Don't wait for your body to tell you, take action now. Drink enough water, eat a balanced diet, limit salt and protein, and seek medical help if you are facing chronic conditions. Because kidney health is not only the key to longevity, but also to the quality of your life. Don't let your daily habits cost you dearly. Protect your kidneys today.